Dear viewers, hope you are keeping well. In today's episode of our PhD PDF Scholarship Podcast, we are delving deep into the intricate corridors of a PhD student's mind. The journey of pursuing a doctorate is as much an intellectual pursuit as it is a test of resilience and emotional strength. To guide us through this exploration is Dr. Geethu Parvathy, a renowned psychologist at Manipal Tata Medical College, Jamshedpur. In this episode, together we aim to uncover the emotional, psychological, and academic challenges a PhD student faces and discuss coping strategies to ensure mental well-being. If you have ever been curious about the psyche of a PhD student or undergoing this journey yourself, this session promises to shed light on many of your queries. And now, before we dive deep into our discussion, let's hear a few words from Dr. Geethu Parvathy. Geethu, how are you and how are you feeling today?
I'm great, and thank you. And it's really an honor to be part of such an important conversation. And I really appreciate this opportunity. Yeah. And I'm sorry, just to begin with, because always people confuse between psychologist and psychiatrist. I'm sorry, I'm actually a psychiatrist. Okay, I'm a person who can treat. Well, psychologists, they usually give talking therapy, so I'm more like a person who treats with medicines. And I'm a psychiatrist. Sorry.
Okay.
It's okay.
I'm sorry for making that mistake.
It's okay. It's okay.
Yeah. Yeah. So now then let's move ahead with our points. Yeah, of course.
Yeah. So, welcome, Dr. Geethu. So, to start our session, first of all, many of us grapple with our thoughts, emotions, and decisions daily without truly understanding the source. So, can you enlighten our audience on the concept of what is mind and why its understanding is important for our overall well-being and self-awareness?
Right. So, about mind, so people have so many different versions, and you can get so many definitions of mind. But since the audience and the participants here are people of scientific temper, I would like to give a scientific explanation of mind. Okay. In medical science, mind is defined as a sum total of your brain's functions. Correct. Basically, the nervous system of the brain, the nerves, and their body itself is part of mind. So the thing is, this nervous system is actually something that connects us to our external environment. That makes animals different from plants. So plants can basically absorb their food and water and everything. Animals can't do that. We need to go search for our food. We need to find shelter. So for that, we need our sense. We need the movement, and all these things are being controlled by our brain. Right. And what makes humans different from other animals is that we have the ability to control our emotions and instincts, and we have certain things called higher mental functions. Like humans are the only animals who are capable of thinking, or we have a way of communication, we have a proper language. So all these things are being modulated by our brain. Okay, so that is exactly what is called a mind. That is all these higher mental functions and the lower mental functions connected together, and that is called a mind. It's a total function of the brain. That's a scientific explanation for that in medical terms.
So I have
About
a follow-up question. So if I give a scenario, like if there is an young researcher,
okay.
so is contemplating or pursuing a PhD amidst of some societal and family pressure. So from your viewpoint, can you shed some light on the nature of the human mind and how self-awareness can guide a person in making such pivotal decisions?
Okay. So about the nature of the human mind, as I was already saying, we have this ability to think analyze the intellect, the abstractability, the judgment. All those higher functions are there. But the thing is, I told you, this can be controlled by various external factors because the mind is our body's way to connect with them. So all the family, the environmental, the societal, financial, all these external factors can influence the brain. Okay, so the mind can get confused when presented with a lot of stress. Okay, so you're asking about like how self-awareness is important. So self-awareness is something that will help you to be more aware about yourself and help you to make decisions, make choices. Okay, and all these things. So awareness itself is like a broad term. Like it includes awareness about one's own strength and difficulties, awareness about one's own thoughts, one's own emotions, his family's financial backgrounds, etc. So when you're coming to a PhD person, usually after doing a post graduation, somebody chooses PhD. uh, Today in Indian scenario particularly, it's highly competitive, and Indian scenario always forces us to study something, then get a job, get married, get settled. Okay, there is a constant pressure from the society. There's a constant pressure, and if you ask our family, if you tell our family members that you're going to do PhD because I'm more interested in science, they'll be like, yeah, get married, get settled. PhD is something that has to be done when you have nothing else to do. Right. Most people do PhD after they get into a job, like for questions, or when they have free time. That's what the concept of the Indian society is. That's the first problem they are facing. So uh, some people some people choose PhD because of, as I told you, there is a highly competitive world. It's difficult to get job, and somebody doesn't get a job. Some people think that okay, I'll go and do PhD. That's also another scenario. Yeah? So about awareness, I will say they have to be aware about their own scientific temper. Do they have the scientific temper to do that? Are they uh, are they doing that just because they didn't get a job, or why are they doing that? All those things they have to be aware about, and also they have to be aware about all these emotions. The pros and cons of doing the PhD, the time. It takes a lot of time. So, and all these things they should be aware about. Okay, before making a decision of choosing PhD or not, because it's a you need that scientific vigor, you need a supportive environment. Even if you don't have a support from your family, you still have to stick on to the decision. You have to face a lot of adversities when you're doing it. That it's a long term thing, it's a research, doesn't have a time period, to be honest. So all these things they should be ready. That part is the awareness about oneself, whether they can do it or not. Think twice and make a decision. I hope I'm clear.
Yeah, yes.
Yeah, it is. So if I can jump into my next, follow-up question on this, like we were talking about like preparing for the. There are a lot of decisions, and they need to kind of have a clear visibility
Yes.
why they are doing it. But then
Yes.
along these lines, right? When some graduate, when they are beginning their search for a PhD, they have to take a lot of critical decisions, and like
Right.
be it choosing a university or be it what topic, right? They undergo a lot of dilemma in the beginning of the phase, right? And from a psychology standpoint, obviously, then can they apply any strategic? Is there any strategic way they can down select, particular options, or from any systematic methodology from a psychology standpoint that you can suggest to the students, other aspirants?
Yeah, definitely. I do have some tips. Like, it's always better to write down. When you do PhD, that's what you write. You write down your ideas, then you try to find solution for that. So I say, when you're having some, confusion, when you're having some stress, when you're confused, it's always better to write down your own thoughts and your own emotions. And then we should always have a plan A, B, and up to plan Z. I don't care how many plans you want to have. You should have all those plans. because so that's always the pro tip is to write down. Okay, and it kind of help you to unfold your thoughts and your confusions. So write down whether I want to do the PhD or not, and then about the universities, about the topic, about the countries. So when you list down these alternate options, you have to think about the pros and cons of each topic. And it's always better to write it down because when you're reading, writing it down, it makes it clear. Okay. And then weighing between the risk and benefits of all those options one can come to a final decision. That's always a better way to do that.
Okay, yeah, that's useful. And so, just wondering along these lines, like, is there any like system when we have to weigh? Then obviously, then is is there any quantitative way, or is there any like methods or something that's proven to work better for such scenarios, right? Because obviously, giving some numbers for pros versus cons is obviously
Yes.
challenging, isn't it?
Yeah, that's a problem. I cannot give you a number,
Yeah,
or I cannot the percentage that this much percentage or in this much percentage of population this strategy is effective
yeah,
because first point is every individual is unique
yeah,
and their decisions are different, their ideas are different. That's the first thing you have to accept. So that is where the self-awareness, the awareness about oneself is in. Okay, that's where they need to know about their own strengths and benefits because I am not you. You are not the other person. You are not Arun. Ganesh is different from Arun. Right? Okay. So your choices of subjects were different. You are two different people in two different countries at the moment. So that is exactly where you need to be aware about yourself. And this awareness comes in levels. You can even write about you can have your own me time for a while. I don't know how many people are getting a me time. Okay. You have to, unfold your mind. You have to spend some time. Okay, and maybe write. I'm stressing writing it down because write it down obviously is actually a proven method. We use it in various types of psychological therapies. There are various talking therapies like cognitive behavior therapies and interpersonal therapies, and we always in all the therapies we recommend writing one's own emotions and thoughts down. If you are doing that on the topic of self-awareness, you can write about one's own strengths, one's own benefits in the personal aspect, in the family aspect, financial aspect, occupational aspect, all those things they can list it on. Any cases, you can just simply write it down because I'm stressing on that because you are obviously all of you have done PhD and that's how you solve a problem. Still, you have a question in your thesis, right? You'll have a research question. And what do? You don't sit and think. Whatever you think, you write it down, right? That is
true.
exactly what you have to do when you're having some issues in your, when you're having some stress, when you're having some confusion. The same way, you have to unfold your emotions and thoughts and confusions. And writing really helps, and that's actually a proven effective way. And the therapies, all these talking therapies, also we use the same technique and this is found to be effective as effective as medications in cases even in cases of mild depression or mild anxiety we use it. Okay, it's as effective as medications, that's the thing.
Right. Okay. Yeah. 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 Thanks for clarifying on that. And just to keep, and I expand on that, a scenario, for example, like people are coming from different background, right? And obviously communication, and when they are start searching for, the PhD positions or something like, they have to effectively learn how to communicate, right? And then, but they
Yes.
are coming from different backgrounds. But then, is there any, techniques from a psychological standpoint that they can effectively utilize to overcome these difficulties?
Yeah, there are a lot of techniques, and well, that there is a statutory warning I have to give. That is, all these techniques and tips. They are just techniques and tips. Okay, So for more individualized kind of things, you probably to consult someone if somebody has had that kind of difficulties. But somebody has minor problems, first thing is communication, right? So first thing about communication is that one person have to be confident, which is not really, something that is, I don't know, encouraged in Indian scenario, I guess. I don't know about most people, but most people comment that, Indians does not have that kind of confidence about their language, about their appearances, or about their, interactions, social interactions, all those. So lack of self-confidence is the most important, most common barrier. People are usually they are afraid. They always, we always grew up in a situation where we were compared to somebody else's son or daughters. We have all been to that situation once, at least once in our life. You look at that guy. Look at Sharmaji's better. That kind of thing, right? So that kind of upbringing in the family actually affects our confidence. Okay. So and the another problem is the people. When I'm talking about confidence, I'm particularly talking about people from an Indian background, where open dialogues are rare, and usually there is a social hierarchy that you have to always respect the elders, those kind of things. Friendships, workplace friendships are not that promoted, and we are at a place where overworking is always appreciated. If you're working for extra hours, you are the best guy. That kind of background we are coming from. So, and another is like a proper language training. Okay, so I've been worked in various parts of India, and I've seen that some part areas the language training is pretty good. Some people, even at school levels, the language training is not that great. Let's just accept all those things. For confidence and for communication part, getting a formal language training, if somebody is planning to move outside, getting a formal language training like clearing IELTS or OET kind of things. And even if I don't think PhD people have to clear all those, right? I don't, not in all countries, right? Some
It is,
countries,
yeah, some of the
different.
countries they have a minimum eligibility criteria. So we should
Okay,
have a 6.5 criteria because
right.
throughout the PhD we will be communicating and writing in English. So they want to make sure that like whatever we are writing, we have that
Yes.
minimum eligibility. So yeah.
Yes.
Yeah, actually, I think that kind of getting a brief training, even if that is not criteria, would be good to improve the language. That's what I personally feel. And another part, whenever you are going outside India, people are more free, more interactive, and more polite, especially in Western countries. So what key is being empathic towards others. By means it's not sympathy. Empathy is more like able to, understand someone else's emotions from their own perspective. Okay. So if somebody says like, oh, I'm feeling tired, in India we'll be like, oh, he's tired. He's not coming for work today. That's what we do. So outside, if somebody says I'm feeling tired, then we are not supposed to express it that way. Okay. So again, in India, it's what I'm sorry to say it, but in India, while I was doing my MD, if a postgraduate student, medical scenario, a postgraduate female student, if she is pregnant, then the other PG postgraduates will be like, oh, she is pregnant, or she will not do all the work. That is the kind of attitude we follow in India. Outside at some other place, if you are going and your lab mate is pregnant, then you are like, you have to be more empathetic, and you have to be, you know more supportive of her. You are not supposed to, do this. That's kind of seen as an offensive thing outside. Okay, so being empathic is one thing, and being friendly is another thing. Like in India, we smile to our own batchmates, our own colleagues. We don't smile that frequently to our bosses. We don't care about the janitors at all, which is not really acceptable if going outside. You have to be friendly with everyone. You have to give respect to even to the janitor, boss to janitor, everyone. You have to be, you have to respect them, and you have to be friendly with them. So it's always good to start off with a smile. Start smiling more often. Just smile at random people. It will give you some positive energy. Okay. So being friendly is another thing. And also, it's always the start of a day when you're seeing people, your colleagues, start off by saying good morning. Okay. Or, hi, just say hi. That's a good thing because, you know, uh, again, in India, we don't do that often. That's exactly why when you go outside, you have to do that. And when you are giving that off to someone, you're just saying hi and smiling at someone, and they smile back at you, and you feel a bit more confident about your communication skills. Okay, start with a simple smile and start with a simple hi, and that's the thing. And another thing about communication I want to stress is about the skill of activism. So you guys are kind of actively listening to me. You guys have been so patient and after saying something. So that is, I mean, even if you are not listening, you guys are at least giving me faces that I'm listening to you. What kind of faces you guys are giving. So carefully hearing what other people have to say is the skill of active listening. The advantage is that will make other people more warm and comfortable. And even if you are not hearing what other you are not understanding a word, when you are new to a place and you are not even understanding a word, you can at least say, nod your head. At least you can do that. So another advantage of active listening is that uh, you know you can also learn language. That's advantage. Simply by starting to interact with other people, simply by listening to them, you can learn language, new words, usages, idioms, or technical words, local language, all these things, and gradually over time you'll feel more confident to talk. So you have to. That's another thing. You have to start talking, start wishing, start greeting others, and by starting, you'll go a long way. That's the thing. And I think I have to add one more thing. Like it's about being open-minded. That's another thing. When you are in another country or facing another culture, you may hear, see, learn new things, which sometimes you cannot even accept. Okay, sometimes a cultural morality thing or new stuff, like maybe it's about food or maybe some other thing. Whenever you are preferring choosing another country to do PhD or postdoc, you have to be really open-minded about these things because you are going and you are interacting with people of another culture. So if you want to feel welcome at that place, you have to be a bit more open-minded. And of course, you may get criticism, but criticism in India is more like destructive criticism. I'm generalizing, of course. There are constructive criticism. Yeah, generalizing. Don't feel bad or anything. But outside countries, when your criticism came up, you have to learn that this is more like a constructive criticism. You have to take it that way because Indians always have this tendency to feel bad or depressed or anxious whenever they get a criticism. So that point also I have to stress. Whenever criticism comes up, you have to be more open-minded about it. You have to accept that you have to try to improve yourself. Does that make sense?
Yeah,
Thank you.
definitely. Yeah.
Yeah, thank you so much for that sort of insights because we can really resonate with what you mentioned. Like we, of course, at times take criticism personally, but they may be
Yes.
criticizing on a topic or maybe on the uh, like point which we have mentioned. It's not on our personal stuff they are criticizing, but at times from coming from an Indian background, like we have that sort of tendency of taking it personally and seeing the other person based on that criticism, but actually that person was focusing on the problem and just to sort out the problem only in that discussion. I think yeah, being an open-mindedness is quite a good thing, and we have to be patient itself at times to get to know what a person meant to say, and it is not us and really on the problem because next time when he see like we may be quite tensed, but that person will be quite like he doesn't like remember all those criticism and all those things. Yeah, they are so cool. But yeah, I mean, yeah, our tendency of mindset will be something like, yeah, he's still remembering that and then talking to me. Yeah, we should hold a warning sign and then talk to him with the filters and all. Yeah, of course,
Yeah,
yeah, that
and
blocks
like
a lot of.
yeah, we were like, oh, we will not talk to that person. He criticized me, and we're not going to talk to him anymore. That kind of
Yeah,
attitude we make sometimes, and it really affects people. There are a lot of people who
yeah,
came back to India because they couldn't cope.
yeah. So I think this is a good point for our listeners as well, because like for someone who's going abroad, like they should have keep all these things. Like of course, technical stuff will you will excel in that thing, but these things also you should be well aware before choosing or preparing yourself mentally moving to another country. So now coming to the next point, it's basically related to PhD research. Research is something like, yeah, you will be in a lab. There will be a lot of lab mates working with you, or people will be working on different topics. Yeah, so research you can't generalize everything, because like for some areas you will get lot of new things at a faster rate. Experiments may not be there, so the research you will get a faster rate. And then like when you try to see, or when you try to benchmark it on a basis of like what all research you got, what all publications you got, what all patents you got. Yeah, some of the research may not produce that much worth research as other research. So this will bring down the morality of the student, and they will try to see, like they will try to compare themselves with the peers. Yeah, why is it taking long time for me? Like why am I not efficiently working it? So yeah, this sort of mindset, like how can we avoid? And could you touch upon the role of self-esteem and its impact on researchers' well-being, and how can one see this thing from a new perspective? Those things.
So that that's the first thing itself is to stop comparing yourself to other. It's kind of in the Indian blood, you know. We, the whole life we have been compared to some other person at school, at college, in life, even when you're married, when you're planning to get married, somebody for PhD, their parents feel like, see, he finished his BTech, he has a job and he's married. So that kind of comparison is in our blood. Okay. So I would say you have to stop comparing yourself with somebody else, because your thesis topic is not somebody else's topic. Your strength is not somebody else's strength. Your weakness is not somebody else's weakness. Okay, you have a weakness. Maybe somebody else is strong at that point. So maybe he's a copypaste. So what? So that's the thing. Everybody is unique, and you have to stop comparing. Like if you're comparing again and again, you will be having more and more of negative thoughts, and there is a high chance that you will develop depression, or you will end up drinking alcohol or something like that. You will have some maladaptive behaviors. So instead of comparing yourself in terms of number of research papers, or in terms of experiments or whatever, just instead of comparing, why don't you just try to focus on your positives? So about being positive, I know it is easy to say that you should be positive. So I'll give you some tips about how to be positive instead of saying you should be positive. Okay. So about being positive, first thing is that you need to, the socialization is of course a big part. Okay, when you are at a new place, you are confused, you have a thesis research topic in your hand and you don't know what to do. Okay, and you're confused, you don't have friends, and referring to a completely, novel scenario, person is in a completely new situation. Okay, so first thing, ideally, I would say that if you're totally confused and you're getting your decision to do PhD at all, you should start by the self-awareness is of course there. All those, unfolding your mind, you can do that. Along with that, you have to start socializing things. That's the first thing. Start by doing some random acts of kindness, like helping a lab mate, making friends. So it starts by saying hi, greeting others, helping others. Okay. So when you help your lab mate, or when you help your, some random, we are just giving them a lift maybe. Okay. So things are simple as that. Such random acts of kindness make the other people in the lab or whatever environment you are in to feel, a little warmth towards you. Okay. So they'll feel like, oh, this person is nice. Maybe I should help him. Okay. So to get that back, you have to do something. Right. So start with this random acts of smiling, of greeting, of helping, and that this other people will feel a small impression about it. So what happens in PhD? Again, a generalized statement. I'm sorry, it's just a generalized statement, not data whatsoever. But people are like, oh, I'm here for PhD. I'll do my work. I don't care about what other people think or say. That kind of attitude, probably, especially if you are in another country, it's kind of acceptable in India. But if you are in another country, it's not acceptable. Okay. So socialization is important. But again, feel more positive. You should have, you know, uh, you have to spend a little bit of time. I'm not saying when I'm saying about spending time, it's not about you have to go party, spend so much time outside, completely forget about the this. It's not like that. But you can spend a weekend maybe with your colleagues, and you can savor the moments, you can click pictures with them. Those kinds of things will help you. And also, when you're away from the family, also you have to be in constant contact with your family members if you are comfortable with them. Of course, you have to be in constant contact with all people you are with, be it family, be it friends. Okay, so all those things make you feel motivated and more positive. There are other tips and techniques like, again, writing things. So about writing the thoughts, the psychiatrists and psychologists usually refer that as a thought diary. So whenever I say you have to diary to any of my Indian patients, they will be writing it. I woke up at 5 a.m., I brushed my teeth, I had food. No, I'm not referring to that. Okay. And I say thought diaries whenever you feel confused, whenever you feel bad, whenever you feel depressed. You have to write about how you feel. Then you have to try to reframe it in a positive manner. I have these issues, but I will try to solve it. That one statement you write down will have a positive impact. Okay, I will try to sort this out. I will try. That kind of statements, when you are repeatedly writing and when you're making it a habit, that things will change your perspective. So negative thoughts, some people say overthinking. Okay. So these things are like, the chain reaction. It's like a nuclear chain reaction. One thing leads, it will be like exponential increase, and converting it into a positive thing is a difficult task. Okay. So what you have to do is just write and try to rephrase it into a positive thing. And you can even write attitude with this. You're feeling you can just write small sentences and post it as sticky notes. I will do this today. Try to do that today. Those kind of things and the social connections, making these things a habit, not just one time thing. Trying this positive reframing and gratitude for one day and then leave it that way, it will not help. Making this a constant habit will make you feel more positive, and each day you will feel more and more confident, and you will be feeling more and more productive. Once you are confident, you will be more productive at your work also. And when you have good social interest, like sharing knowledge, for example, sharing knowledge does not happen much in India because, oh, this is my paper. If you know, sir, you will get more of the paper. So, no, I'm not going to share. Sharing knowledge is different. You have to share knowledge with your colleagues sometimes if you want some details. Okay, so that kind of an interaction is needed. That kind of, this kind of small things of random acts of kindness and, gratitude, others, all those things make you feel more confident, make you feel more, positive. And whenever somebody feels too down and, too confused, I would say just relax. Just take a break. Just take a break. Try to relax. and try to sort these things out. Have your own time and try to sort these things out. That would be a contribution. And once you take this time off, and then you can come back fully charged and put your maximum effort. Anyway, hope you got the points.
Yeah. So you talked about like we shouldn't compare with the peers, but often in PhD, like there is always deadlines. Like in
Yes.
the worst case, there is always a team meeting in every 2 weeks or maybe in every month or something. So we are often faced with deadlines during a PhD. And it is sad to say that only over the recent years in India, we started talking about work-life balance also. Like there is an importance of work-life balance should be there in research or in any other kind of occupation that you do. So during all these scenarios, like what stress management techniques, especially related to this time management, relaxation, and anger management, can you recommend to our audience?
So, when you are the one with deadlines, be it in PhD, be it in your life, your parents will also give you a deadline. You have to marry before 30, right? So, whatever be the situation is, you have to have some realistic goals. That's the thing. Whatever may be the situation, you have to have some realistic goals, be it short term, be it long term goals. So, I think planning and prioritizing would be a nice option. You have to plan stuff. That is where the me time steps in again. You can use this me time. That's you can spend yourself some time. What we used to do is whenever you're working, you work. After that, you take a break, and the break is usually by watching TV or randomly scrolling through social media pages. That's all. Okay. We don't really spend a time to unfold your own emotional thoughts and all these deadlines, right? I would say that it's always better to plan, make a do list, maybe sticky notes, set goals, and again prioritize them. Based on the prioritization, you can convert them into long-term goals and short-term goals. And one most important thing is to avoid procrastinating. If you have work to do, you just need to work. And instead of pushing it to last minute. And again, with the time management, that is the thing about time management also. Discussing and finishing of your work little bit at a time, okay, will help you with the deadlines. Like, for example, if you most of the Android phones and the iOS phones, they have this inbuilt settings nowadays to keep a track on your screen. Okay, so even if today, especially after COVID, I'm seeing a lot of cases, not only just students, kids, the adults, the corporate sector people, coming to this complaints that I'm not getting any time. And I'll be asking them to check their screen dates. And the screen dates will be like 4 hours, 6 hours. What are they doing? They're just scrolling through Facebook, scrolling through Instagram, or maybe watching news for hours. Okay. So you have to know, everybody is having only 24 hours. You have to know where are you spending your time and then make and prioritize things and then do it for it. Okay. So that's the thing about time management. And whenever you are managing your time, it shouldn't be at the expense of your me time or your sleep. I'll always recommend whatever you learn. Scientifically, the memory is getting consolidated when a person is sleeping. Okay, that is when all the memory consolidation things happen. So, for an adult, at least 6 hours of sleep is needed. Whenever the Indian work culture is like you can avoid sleep, but you have to do work. That's Indian culture says. But I will say you have to sleep at least for 6 hours, and that will help you be fresh and be clear. And of course, other things are like food and exercise. Again, people don't give importance to food. They will just skip breakfast and go for work. Don't do that. Have your breakfast. You can skip dinner if you want to, but have the breakfast because The brain needs to recharge after 12 hours of fasting. So you have to have your breakfast and a little bit of exercise. That is also important, like at least 30 minutes of moderate activity that will release certain chemicals in your brain called endorphins, which actually calm your mind, help you think better and be clear. So all those things will help you manage your stress. And regarding the management of, I think you asked about anger management, right? Yes. Yeah,
Yes,
anger.
yeah.
Yes, yes. So it's like I'll say it's more about emotional management. Some people have anger, some people will cry. If it is ladies, ladies will be like more like crying into crying. The gents are more like into frustration and anger. It's more like a testosterone estrogen thing. So I'll say whatever may be the emotions, whenever you're feeling overwhelmed and whenever you're feeling like you'll break down, it's always it's always better to take a moment to pause. Just pause for a moment. Okay. Just try to think before shouting or screaming at someone. It's always better to pause and think whether I should do it or not. And it's better to keep yourself away from that situation. Like if you're hurrying, if you're at the verge of breakdown, just go away from it. Just go to the washroom. Just go to the washroom. You can scream there if you want. If you really want to scream or shout, you can scream in the washroom. Because screaming or shouting at someone is kind of considered offensive if you are in an outside country. Okay, and you can use other techniques like you can take a walk, distract yourself, or you can just drink some water. Anyway, you should try not to respond, not to you know be frustrated at your research guide or your lab mates. Try not to do that. Just pause, distract yourself, and then when your mind is clear, then come back and discuss. When I say discuss, I'm meaning discussion, not arguments. Okay, don't try to argue with others when you are in an outside country. It's super offensive. Okay. So these are some techniques, but if you see some people still have difficulty controlling their emotions, I would say they should seek help from a mental health professional.
Uh,
All right?
yeah, thank you for providing that. But I would like to take it to a next level. Say, for example, if the
Mhm.
see if you take it in IITs, like you will see that suicides have become a, to be honest, like a very common thing at majority of the IITs. Like per year, we can see 5 or 6 of the young graduates or researchers or master students. They put an end to their life thinking being like being educated is the last thing, and if they are not able to get into that limit, then they don't have anything, and they have to put an end to their life. So among the research community, also there have been observed cases related to autism and then getting addicted to drugs. They try to find a way to what fulfill themselves through these manners, either by suiciding or by taking other ways. So, like, what is your call on these sort of activities? Like, what are the best ways that they can train themselves, or at least, say, for example, if I see my colleague is not doing well, at least from a second person's perspective, like, how can I help him? Okay, I'm seeing that that person is not coping up well, and he's not, he's finding different ways, but I want to convince him, and I want to make him feel that yeah, he's worth enough, and at the same time, like, he should also feel the same, that I'm talking to him in that way to bring him up and avoid from what he's thinking as the dead end decisions. So, as a colleague, what can we do, or like when you come across limits beyond one person's limit?
So about this suicide and other maladaptive behaviors, it's actually a whole other point to discuss. It needs like an hour or so. But to be concise, the competition is really high. First thing, that's the truth. We have a lot of competitions, and Indians are all over the world because we don't have much chances in India. Even doctors are negative. And whenever, if you remember, when you were in your high school or your 11th or 12th, The only option our parents presents to us is either be a doctor or an engineer or a CA or maybe a lawyer. We are presented with limited options to do while we are studying. Okay, that's one thing. We are not open. We are not even open to other options. Okay, and then they force parenting is all other thing. That's another kind of stress in India. So I'm not going into the details of all those things, all those causes of why these things happens. Competition is one thing. Lack of opportunities is another thing. The socioeconomic problems, the pressures. Okay, and there are allegations in India because IIT is recent. Last weekend or so, you said happened in IIT Delhi. The allegation is about discrimination. We don't know the truth, but the allegation is that there was discrimination. So there are different kind of stresses. So whatever the stress may be, going into a suicide thought of maybe I should commit suicide or maybe I should do drugs. They are what we call a maladaptive behavior. And I would suggest if you feel like your colleague is going into such maladaptive behaviors. So I would like to list out some maladaptive behaviors here. Like for example, if somebody is feeling low for too long, he is not interested in going out with his friends or doing his work. Okay, it may be a sign that he is depressed. Okay, somebody use too much. Occasional social drinking is okay, but somebody is using too much of alcohol. Smoking whenever he or she is stressed, or using illicit drugs, or somebody is having panic attacks, like pounding chest and shortness of breath, and they're just shouting and screaming. This could be a panic attack. Okay, so if you are seeing somebody, all these things are, red flag signs. Whenever you see people having such symptoms, it's ideally you have to direct them to a mental health professionals, because what we are discussing today are just tips and techniques to deal with everyday stresses, and that is not for someone with a maladaptive behavior. Okay, they need more guidance. They need more individualized care. So what you can do is the communication skills comes again. Okay, like you have to be empathic with the person. You have to try into them, try to listen to them instead of try not to advise them a lot. Okay, try not to advise them. I strongly push on that one. Try not to advise them, but just be empathic. Listen to what they want to say. And then gently, when they feel more comfortable with you, gently suggest them to seek help from a mental health professional, because these are maladaptive behaviors. And when any person for that matter, trying to harm themselves is a serious situation. Okay, they need help, maybe in the form of talking therapy. Some people even need medications. So just gently guide them. Okay. And seeking mental health treatment is still a stigma in India. It is changing, the situation is changing, but seeking treatment, even talking to a psychologist, oh no, that means you are not strong enough. That's the kind of attitude people are hard. And I really hope, because you guys are, other countries, the importance, So it's always, let them have some support from friends, because family members may not give that support. Family members may not give that support. So just give them the support, Make them feel that this is usual, this is normal, it's okay to get help. Okay. Be that support. We can sell many of them today.
Before they go to such extremes, obviously there will be it's not like one instance, right? It will be like this all happens over a multiple courses, right? So but before they end up going there, obviously they can divert their like maybe maintaining proper work-life balance or something, could have better these situations, for example. And obviously many of the researchers today, like they feel like they maybe sacrifice too much for their work and maybe giving less importance to family. And from a psychological standpoint, how they can really reconcile all the past decisions and what they come across, or and then think ahead and then really reconcile it and move forward with and with a positive mindset, right? And what from a psychological view class, and what would you advise for to really make a positive way forward for the aspirants?
Yeah. So about work-life balance, I would say um, you are working for a period of time. You have to devote that period for your work, of course. And most countries have this 8 hours limit, I guess, right? It's 8 hours a day, right? Yeah. So after that 8 hours, you have 8 hours of sleep. Then 8 hours for your life. Okay. So when it comes to PhD or post any research for that matter, the thing is like you need to spend more time using your brain. Okay. So you have to like, you know, I would say like if you want a life, you have to decide whether you want a life or not. Like, for example, from Einstein to Abdul Kalam, they just decided that okay, I'll devote my life to research. Okay, and they did that wonderfully. So you are that kind of a person. Everybody have a choice. If you want to choose research over everything, it's fine. You can choose that. But if you want other part of life too, then you have to spend some time with that. And especially, I would say that again, this is completely against the Indian scenario. But I will say that marriage is not everyone's cup of tea. If you are ready for that, go for it. Okay, and it basically it's not like your parents find someone and you get married to them on the next week and just make two kids. No, it doesn't work that way anymore. Not anymore. Okay. So it involves two people's lives. They are devoting each other's lives to each other, and you should be really ready to commit for that. And if a person who is into research is not ready for that level of commitment, please don't. So just like the decision to do PhD, you have to decide whether you want to get married or settle down. Whatever it is. That is it. You have to decide. You should have some realistic ideas about marriage. Nowadays marriage is not a big thing. People are in living relationship also. You can choose what you want. Choose what you want. And be open. Try to communicate it with your partner also. For that is. Okay. So you should have some realistic ideas. If you want a partner, then be ready to spend some quality time with them. Quality time does not mean that you have to go on vacation every other months, or it's simple. It's maybe a dinner time, half hour time you are spending for the dinner. Okay, you can set your mobile phones apart and just talk each other. That's a quality time. Okay, it's not that you are going for movies, weekday parties, or date nights. Date nights are good. Of course, date nights are good. I'm stressing someone who promotes date night. But then, even a simple conversation while you're having dinner, talking to each other, sharing your views and your problems, issues would be really nice. And for that, you need to spend some quality time, and you should be committed to that. A commitment should be okay. And choosing the partner also is very important because again, not a random person. It could probably give them depression too. Okay, I am seeing lot of depressed spouses these days because the usually the husband, not always, but usually the husband, mostly the husband, they're like, oh, I'm working hard. Okay, I'm super busy. And the wives are like always, he doesn't have time for me, I'm depressed. We are seeing so many depressed wives. Because it's India, the other way can also, the other way around also happens a lot. And some people you're saying about Inish was saying about when what happens when them becomes late, right? Late for marriage. You were saying asking something like that.
Yeah.
Somebody is too. I would say it's never too late. Especially if you are an outside country. In India, yeah. If you are over 35, you won't get a girl. It's never too late. The situation is changing these days. It's never too late. If you want to find someone, you can find someone. But what usually happens is when somebody is past a certain age, they start to feel depressed. Then their mind is full of negative thoughts. They'll go for a vicious cycle of negative thoughts and negative behaviors and negative emotions, and they don't try to get out of it. I'll say that there is still time. Okay, there is still time. You can find someone still if you want to. This is a era of dating, and even married matrimony is having divorce matrimony these days. Yeah, they have. So you can always find someone. And it is always ideal if your partner is someone who understands your struggle. That's the thing. Because PhD period, everybody thinks that, oh, researcher, he's making a lot of money. No, not it. He or she is making a lot of money. No, not the thing. You have to make sure that the partner also understand your struggle, and you have to put the effort to understand their struggles. It's a give and take thing. Okay. So again, having kids also, it's your choice. If you want to have kids, well and good. If you don't want to have kids, have an understanding with your partner from the beginning itself. And about kids, I think Nirmal was mentioning about autism or something earlier.
Autism,
So
yeah.
one thing I would like to stress that scientifically there is evidence that advanced maternal and paternal age can affect the kids. Either they can develop autism or ADHD or even intellectual disability. So that is one thing. Like if you are someone who wants to have a married life and have kids, ideally, I would say that try not to delay it too much. Try not to push it too much because of the medical risk. Because advancing age is always a risk to develop genetic disorders. So, if somebody wants to have those things, be ready to have those things. If you don't want that, be content with your own decision. It's up to you always. Alright? I hope
Yeah,
I'm clear.
it's clear. Yeah, it is. You are clear. Yeah, thanks.
Yeah, thank you for sharing some sort of open thoughts on these critical topics. So by this now, we have come to the end of this session. We deeply appreciate Dr. Geethu Parvathy for shedding lights on the intricate phases of PhD students' psyche, and from understanding our mind to balancing life demand. Her insights were truly enriching. So, as we wrap up, remember, like if you resonate with any of the topics that we discussed and need further guidance, feel free to connect to the counseling sessions with Dr. Geethu Parvathy. She can guide you to the concerned people. So, until next episode, prioritize your knowledge and emotional well-being. And thank you for being a part of us.
Thank you for having me.